This video has been seen 1.7 million times and contains some dangerous misinformation about personal treatment in cancer. Let's take a look at it.
If I got sick tomorrow with the big C, can't really say the whole word, this is what I would do.
I already do these three things, and I don't have that, but I feel like everybody should do it just to maintain health. I am a registered nurse of about 14 and a half years, so I have a pretty good background in speaking to this type of thing.
No, you don't have a good background in dealing with these things as a nurse of 14 and a half years of whatever experience you have. You know who has a good background? A board-certified oncologist. As opposed to 2 years of a nursing degree, they have 4 years of medical school, 3 years of internal medicine specialty, 3 to 4 years of studying oncology or cancer cells and seeing thousands of patients. They have a good idea of what they're talking about. You're a nurse, and while you have wonderful things to say, you should not be giving medical advice like you said, but clearly you are. Let's see what you're going to say next.
And that condition that I'm talking about has exploded over the last couple of years, if y'all know what I mean. Number one thing, I would start intermittent fasting.
Intermittent fasting does not prevent cancer. Intermittent fasting is good if you want to lose weight, and intermittent fasting has been looked at in some clinical situations to reduce some of the side effects of chemotherapy. There are dangers of doing intermittent fasting while you're undergoing chemo or radiation therapy, and that is you may not get enough calories. Because remember, when you are undergoing therapy against cancer, you need all the resources you can muster. So if you think about doing intermittent fasting, please talk with your oncologist first and do not think intermittent fasting is a substitute at all for cancer chemo or cancer radiation therapy.
If you've never done that, go check out the book called Fast Like a Girl. It's by Mindy Pales. It's what I read, and I learned all about the benefits. It's amazing. And no, I'm not encouraging an eating disorder, TikTok. Intermittent fasting is a pretty healthy thing. Second thing I would do is apricot seeds. I eat them every day.
Apricot seeds have been actually investigated quite well. They used to be thought of as a nature's cancer chemotherapy. They called it Laetrile. It has been studied quite extensively. It does not prevent you from getting cancer. It is not being able to treat any cancer, and it actually contains cyanide and are dangerous to consume. So please, don't consume apricot seeds. There have been some tragic stories of people who have gotten very ill from cyanide poisoning from it. And no, doctors aren't trying to keep you away from conventional therapy because they want you to not eat apricot seeds. They don't work, and they're dangerous. And yet, this continues to persist in the popular lexicon of those who don't want to undergo traditional treatment, which has proven results. Let's see what a third one is.
If you don't know what the benefits are of eating those, go look them up. I think everybody should eat them. They're nutritious, and they have many, many, many proven benefits. And the third thing I would do is a parasite cleanse.
Ah, the parasite cleanse, the current darling of people who don't like